Recording in progress.
I'm hearing an echo. Jason, Liz, I have 5:30 on my clock.
Okay. 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 So, do you hear me okay?
Yeah, we'll start now?
I think now is good.
Okay.
Thank you.
Good evening, everyone. My name is Ernesto Portillo. I'm the Public Information Officer and Community Engagement Coordinator with Housing and Community Development Space Team. Welcome to this afternoon's forum on ending homelessness in Tucson, charting a path forward. It is a continuation of a two-day session that was held last month. And with us this evening is HCD Director Liz Morales and Jason Thorpe, who's a Community Service Manager here in Housing and Community Development. We thank you for joining us. This is, of course, a very critical topic, something that HCD has been working on for a long time. And so we'd like to, again, welcome Liz Morales and Jason. Liz? Here's our agenda. Liz will talk and followed by Jason, and then we'll have your community input. We have some questions to prompt some discussion. This is primarily to listen to you, the participants, the community.
Great. Thank you, Ernesto, and welcome to everyone. Thanks for coming on an evening. It's sometimes it's good to do it in the evening so people who are working can join us, but it also means you're giving up some of your free time. So thank you for those of you who did that. I want to just share some thoughts. Again, this is less about us talking and more about us listening, but we between Jason and I, we definitely want to set the stage as to what has been happening from the city's point of view and from a community planning point of view. And I want to take the perspective of what the city is doing. And if you, some of this may be repetitive if you listen to the mayor and council meeting yesterday. So I'm going to do a short review of some of that work. But I definitely appreciate the work that Jason and so many others that participated in our forum that took place a few weeks ago. That was a really good set aside time where we could really talk about a lot of the things that is happening and things that we want to see happen for our community. As I looked at those who signed up for this evening session, I was really impressed by the diverse representation of people attending. I saw local residents, including some of those who are formerly unsheltered, business owners, community nonprofits, advocates, and those working with mutual aid organizations. And it demonstrates to me that our whole community of Tucson and the Pima County region, we all care, and we all want to be involved and informed on how we can what can we collectively do to address this complex issue. This affects everyone differently in various ways, but we are all working together toward a similar goal, and that's of ending homelessness for as many people as we can. This can only be done together, everyone together. And so I appreciate, again, that you are part of that everyone, and that each of us can play a part in this. As a recap to what was discussed yesterday, the city manager presented to mayor and council some things that are currently happening. And again, as we've done many efforts over the last many years, when I joined the city of Tucson over 3 years ago, we're already doing a lot of street outreach, housing, and some different things, but we know that that was still not enough. So we've significantly expanded the work that we can do. And with the blessing of mayor and council through funding and resources. One of the things that has happened in the last 60 days is the city manager formed a weekly working group that includes multiple departments and partners, including Pima County. Out of this work, some things that have happened, we have developed a reporting system that will be public facing, that would be launched hopefully sooner than, but no less than the next 30 days. This reporting system will track areas of concern, such as significant trash and debris and sites that have unsheltered occupants. It'll be a way for the public to submit basically an online form as to where those areas are. In addition to that, staff have developed an assessment tool that will be used to identify sites, the level of potential harm or safety concerns. And based on that assessment, we will determine the sites based on a tiered system. So for instance, tier 1 would be a site that has no occupants and just requires cleanup. Whereas tier 2 sites would be places where there are unsheltered occupants, but they don't pose health and safety risk, but does require a cleanup. So we can go clean up without moving anyone. And in that process, we'll also engage the occupants with services and also connecting them to housing and shelter if we can get them into housing and shelter. And then finally, tier 3 are those sites where there's unsheltered occupants, but it scores really high on the assessment tool that results in relocation or identifying places where we can place the occupants. And then again, the crew for cleanup will follow up once the relocation happens. The mayor and council have approved funding to do an expansion of this cleanup to environmental and general services, expanding crews and working with the current homeless work program that is administered by Old Pueblo Community Services. And so that is one of the many efforts that's been happening over the last 2 to 3 months. When we talk about our sites that the city owns, there's 4 sites, 2 that are operated and by Community Bridges, and 2 that the city staff are operating. So just as an overview, there's 152 people currently residing at the 4 different sites. And we do plan in the next 60 days to increase capacity by adding 2 persons per room, just because we know we need more space. And so that'll add about an additional 60 beds. And tonight, Brandy Champion, who's our Housing First program director, couldn't join us, but she is overseeing the 4 sites along with the outreach. And so one of the next steps with outreach does a lot of different connections to different areas and encampments. One of the additional efforts that they'll be doing is along the I-10 corridor and doing some outreach and working with the businesses there. We understand that the 4 sites we have, even at the maximum of 200 210, 220 beds. We know that's still not sufficient. So we are exploring the option to lease a space where we could do a larger congregate space that would be very low barrier, which means there's not a lot of requirements that will allow people to bring their pets, have couples. Some of those features that we know our traditional shelters can't always address the shelter needs of all our unhoused residents. So we're looking to do that. It might take a minute to find a place, but we know that we just need more shelter. I'm also happy to report that we received a commitment from Arizona Department of Housing to match $2 million of city funds to expand the homeless work program, to increase shelter, outreach, navigation. Navigation is our people who help people find housing and connect them to the needed resources. And it'll expand the work crews that Old Pueblo Community Services does. We also, with those funds, will plan to buy a mobile shower that will go around the city to different locations. And then we hope to also expand that work to other nonprofit agencies that have programs related to workforce development, so that we can help connect people to more stable income and, of course, stable housing. A couple more updates that the city manager provided. He did appoint Mari Vasquez to coordinate efforts among all the departments. I believe her title is Interagency Coordinator Manager. And so she is going to be very vital to helping us make those connections across the departments, with a focus and a priority on businesses. So if you haven't met Mari, she has a great background already working with the fire department and understanding our community resources. Finally, one of the actions that Mayor and Council took last night was to direct the city manager to work with the county to hire a regional coordinator to work across the city and the county to make sure that the resources and the coordination is much better, and making sure we're working towards some similar common goals. So just wanted to give you that update from a city perspective. Again, we continue to, we are committed, and Mayor and Council are committed, and through both word and action and funding, to make sure we're doing all we can to help support, again, our residents, both housed and unhoused, and our businesses, and also supporting our nonprofits and mutual aid organizations who are out there doing this work, this direct service work. So thank you to all of you for your different, the roles that you all have played. And I'm happy at the end of the presentation to answer questions, but more importantly, we want to hear from you about what you're seeing and what you hope to see continue happening. So thank you again, and I'll hand it off to Jason.
Thanks so much, Liz. As Nito mentioned, my name is Jason Thorpe. I use he, him pronouns, and I'm the Community Services Administrator here in the Department of Housing and Community Development. I'm going to follow up a little on what Liz shared, just to provide some background information on today's session and the work that's led up to it, as well as sort of current data and our understanding of what's happening as it relates to unsheltered homelessness in particular in the Tucson area. So if we could proceed to the next slide, please. So first, to provide a little bit of background, and I know looking at this participants list that many of you attended our two-day community planning forum in August. So last month, the City of Tucson and the Tucson Pima Collaboration to End Homelessness partnered to host a two-day forum, really to hear from the community and engage in cross-sector planning and collaboration, both to think about how we as a community address homelessness overall, and also in direct response to a funding opportunity that's been released by the U.S. Department of Housing and Urban Development. And so this we know that as we hold large events like that and do a 2-day session, while there were about 100 folks who were able to attend, including 15 people who were residing in emergency shelter and housing programs, which is really fantastic. We know that most people can't commit to full days, but may have really important feedback or input, as well as experiences about how the current homeless situation in our community is impacting you and your neighbors. And so we wanted to hold this session to provide that opportunity for folks who may have missed that 2-day session to still be part of this planning process as we continue forward. So before I continue on, I also, as I mentioned, this is a partnership with the Tucson Pima collaboration to end homelessness, which is a membership organization of about 50 community organizations, as well as nearly 100 individual community members at this point. And so I want to recognize a couple of folks who I see here in the list. So I want to thank Jocelyn Musine, who is the Tucson Pima Collaboration to End Homelessness Board Chair, and Samika Milligan, who is a member of the Continuum of Care Board, both of whom are here today. And so their leadership really supports this type of work, and we have incredible gratitude to the Continuum of Care. So through that 2-day planning session, there was significant recommendations and opportunities identified. We've tried to distill those here to not spend too much time providing a presentation, and really, as Liz mentioned, this is meant to hear from you. But we did want to share some of the key priorities that were identified through that process. Included strengthening our community outreach and engagement services in the community. So how we engage folks who are unsheltered, and how we're meeting their most basic needs in a more coordinated way. Increasing our supportive housing supply. And so when we say supportive housing, we mean funded programs that provide both housing as well as those supportive services that people may need to be able to maintain that housing long-term and achieve their own goals, whatever those might be. Priority on increasing our affordable housing, or our supportive housing supply, and particularly permanent supportive housing. And by that we mean housing interventions that may not be time limited. So they're really designed to last as long as that person needs them to be able to remain stably housed. The third priority is really at mitigating barriers to permanent housing that we're experiencing in our community as a result of rising rental costs and ongoing source of income discrimination, which Liz may, a bit later, there may be an opportunity for Liz to provide a little information there, but as many folks, if you saw the news today or watched Mayor and Council's meeting last night, have learned that Mayor and Council yesterday approved a city ordinance that will now prohibit discrimination based on source of income and rental. And what that means is that someone who has a voucher or a housing subsidy, they're receiving rental assistance from a community agency or a government program like the Housing Choice Voucher Program, what people sort of know as Section 8, that can't be the reason that you don't rent to someone. And that's really important progressive policy in our community right now. And then lastly, focusing on integrating housing with behavioral health services, substance abuse treatment, and other supports to help people succeed. So those were the primary priorities identified through those discussions. We can continue on to the next slide, please. So as we talk about that supportive housing, I think it's important to provide a little bit of information about housing first. So housing first is an approach that you may have seen in the media, or if you've been, many of you participate in activities with the city and other partners related to homelessness response. And we're always talking about housing first, which is an evidence-based approach to addressing homelessness that really focuses on moving people into permanent housing first. So it's not a shelter strategy. It's not, and there's not this idea that you have to deserve housing or be housing ready. It's principled on the foundational belief that all people deserve permanent housing and that every human is housing ready. So when we think about some of the core principles of housing first it's that idea everyone is housing ready. People may need support to maintain that housing, but they're ready to be housed today, everyone is. Second is that any person who's participating in a housing program has a right to personal choice and self-determination. So the services that are provided through these programs are voluntary but encouraged. Next is that these programs really focus on supporting recovery from trauma, substance misuse, or other barriers to stability. So that recovery orientation that really recognizes that that someone's housing situation is not necessarily the result of poor decision making, but really the end result of complex and systemic challenges. The fourth key tenet is that services and resources are individualized to every person's needs. So it isn't by getting housing, you agree to do this full list of things that has to apply to everyone. It's about addressing the barriers that exist for that individual and their housing needs. And then lastly, housing first programs are embedded within local communities. So we are not trying to create enclaves of housing. They're only for people experiencing homelessness that are separated from the local community. We know that community integration promotes social connectedness, reduces isolation, and helps both people who are coming from homeless situations, as well as the local community, thrive and be better adapted together. So our department does have a website that specifically provides more information about Housing First. We've included that link here for you. And we can continue on to the next slide, please. So before we jump into the community input session, we wanted to provide a little bit of data just to share what's going on locally and what we're seeing and how we're interpreting some of that data related to homelessness. So in terms of the scope of the homeless situation in our community, approximately 5,200 people are interacting with local homeless assistance programs in some way on an annual basis. And so that's from the local continuum of care, again, Tucson Pima collaboration and homelessness data sets from 2021. And so that tells us, kind of the need on an annual basis. And then we want to think about what is the need on a single night. And it's not that night, any one night is going to be more true or less true than the other. But when we think about how much housing do we need, knowing the demand on a single night helps us understand the inventory that we need to end homelessness. And that's really our goal, is to truly end homelessness. And so in February of 2022, we determined that approximately 2,200 people, 2,227 on a night in February, are experiencing homelessness on a nightly basis in Tucson. That includes about a little over 1,600 people, 1,649, who are unsheltered, meaning that they're residing outside in a place not meant for human habitation, maybe an abandoned building, something like that. And that's really what we generally think of when we think of homelessness, right? But we know that's actually not the experience of most people that are experiencing housing crises. And then 578 people are sheltered. And so when we say sheltered, we're referring specifically to like emergency shelters, those types of programs, shorter term transitional housing programs, et cetera. Those are not those long-term permanent housing that we're talking about. So on any given night, for every person who is sheltered experiencing homelessness, there are close to 3 who are unsheltered. And so that tells an important picture of homelessness. What's left out of it, and that data comes from the annual point in time count, which is the data point most people are used to hearing when they're talking about a count of people experiencing homelessness. What's left out of the point in time count is the number of people who are residing in longer term supportive housing programs that are receiving services on that same night. And so that we know in our community, we have the capacity, the existing programs in our community, rapid rehousing, permanent supportive housing, projects like that, to house 2,440 people on a nightly basis. So when we look at that overall, now we know there are about twice as many people being supported in housing solutions every night as there are unsheltered. So about 3,118 total, which includes that 578 who are sheltered and that additional 2,400 approximately residing in supportive housing. What's important here to know, we can say that that's great. We've got twice as many people receiving assistance as not. But what this data is really telling us is that our nightly gap in our community is about 1,600 people who are sleeping outside or in some other very dangerous, unsafe situation. And so that's the key, population issue we need to address and be focused on. We can continue on to the next slide, please. So then if we think about what does that look like compared to recent years, I think we're all seeing homelessness, unsheltered homelessness in particular, much more than you have in the past in Tucson, right? We know that we're all living in the same city. And so we can look at things like the point in time count and note that, yes, we know homelessness overall is absolutely increasing in our community. The point in time count, and you'll see that on this left set of bar graphs here, in 2019 and 2020, we did the point in time count in the way that it's been done for years and years and years, which is a couple hundred volunteers get together very early in the morning. And they all go out and we quadrant the city into sections, and people find folks who are sleeping outside and ask to interview them. And then that results in this count. And so that's how the count was done in 2019. In 2020, we actually saw a modest reduction in the number of people that were counted as experiencing homelessness in those years. In 2021, because of the COVID-19 pandemic, we were not able to do that. So instead, we contracted with researchers at the University of Arizona Southwest Institute for Research on Women. And I did see that Dr. Keith Bentley is here as well, who is a primary researcher on this project. And so that team was able to develop an unsheltered estimate using statistical analysis. And so in doing so, they estimated homelessness had likely increased to about 1,600 individuals. Now in 2022, once again, we did not do our typical count because we were experiencing a variant surge at that time. So January, February of 2022, we saw this spike in variant transmission with COVID-19. So we didn't do the normal kind of canvas count. And what we were able to do was get approval from the federal government to use an alternative method that allowed us to count people using our administrative data. So the data that we know of the people we already know, and then to validate that through targeted canvas counts in a few densely populated areas. In doing that, that's where we came to that 2,227 people. So, an easy story that could be told here is homelessness in our community has increased from about 1,300 in 2019 to 2,300 in 2022. We know because of the methodological change, the methodological differences in those years, that the increase is not that steep. With that said, we are still seeing significantly more people experiencing unsheltered homelessness. And so I would challenge folks to look at that, that graph on the left, and note that in that top sort of lightly shaded numbers, those are the people who are unsheltered. And in the darker blue, that area, those were the people who are sheltered. So what's happened since 2019 to 2022 is a significant reduction, nearly half, nearly a 50% reduction in the number of people who are experiencing who are sheltered and counted as experiencing homelessness. And we know that reduction in the number of people who are sheltered relates directly to reducing bed capacity in those traditional congregate shelters because of the COVID-19 pandemic and public health risk. And while the city and the county and others, many nonprofit organizations have done incredible work to try to increase the number of non-congregate shelter beds. So shelter that maybe is like in acquired hotels and things like that aren't sort of dormitory style. We just haven't been able to create like a one-to-one replacement of those beds that were lost. And so as a result, we see this significantly reduced number of people who are sheltered. And that's really what we believe is resulting in this much higher rate of unsheltered homelessness, really has to do with reduced bed occupancy. And so on the right-hand side, you can see there this sort of steady decline in shelter bed occupancy on the night of the point in time count. There in number of occupied beds, about a 25% reduction, whereas the number of person sheltered, which accounts for some beds that aren't year-round, that's where you see that more like a 40% reduction. You will see in 2021, there's that spike on the right-hand side where the number of beds increased. So that count was conducted in January of 2021, which was the time in our community, it was at the height of the COVID-19 pandemic, and the city and the county and a number of community agencies were partnering to manage large hotel shelter operations for people who were either at risk of severe medical complication associated with COVID-19 or who had contracted or been affected by COVID-19. And so, so there was this period of about 9 months where about 400 additional shelter units were brought online. And that was a crisis response at the beginning of the pandemic, but wasn't able financially to be sustained through 2022. And so that's what accounts for that spike in early 2021. So what we're seeing, and we really want folks to understand, is that we know that there are so many more people experiencing unsheltered homelessness. The data is not yet suggesting to us that we're seeing large numbers of people that have been kind of forced out of the rental market who are experiencing homelessness. That is happening. It's absolutely happening. But when we see this large number of unsheltered homelessness, what we believe the primary driver has to do with the displacement from shelter because of reduced shelter capacity in the community. So we can continue on to the next slide. And so hopefully that that information sheds a little bit of light on what we're seeing around us. When we always want to encourage folks, if you are doing work related to homelessness, want to know more about the data, to reach out to us here at the city, to visit the Tucson Pima Collaboration to End Homelessness website at tpch.net. We're really happy. There's a lot of data at this point that we are able to share publicly, and know that that data can help inform planning, so that we're really planning around the true needs in our community, and not necessarily our assumptions trying to interpret these changes over time. So with that, thanks so much. I will turn it over to Neto.
Thank you, Jason. Thank you, Liz. We do have some questions in the chat box, and I'll get to those questions. If you would like to ask a question, ask the question directly, please raise your hand and I'll unmute you. But first question comes from Betty Bitgood. The question is, the coming low barrier shelter project, will shelter be within a building?
Hi, Betty. Yes, that's the intention. You know, again, we know that having for me, I'll just speak for myself, shelter is with a roof over your head. So creating a place where it's safe and out of the elements, that's the goal, is to try to expand that. As Jason indicated, we've seen a big decrease in the number of bed capacity with our shelters. So where we can help in that is possibly opening up another shelter, and it could be something that we coordinate with existing providers, or we expand our work. But you know we have some amazing shelter providers. The main thing with this shelter that we want to find and locate and open up, it's got to be a shelter that is accessible and can accept people kind of where they're at. And so that's what we're shooting for.
Okay. There's a question from Samika Milligan. And Samika, would you like to ask that in your own voice?
Sure, I can.
Thank you.
Sorry about that. I was kind of driving when the lady was talking about the program where the community will have a place to put in like locations of the camps that need to be cleaning. Was there a name for that project or program?
There's not a name, but that's what we've done with our Wildcat, and now with the No-Tell Motel. We of those places that we were trying to address and relocate people, because we needed to clear out those areas, we were able to place them into those non-congregate shelter sites that we have. So as we engage, we're always trying, and we don't just place them in our sites. We Gospel Rescue Mission has been very helpful, Salvation Army and Primavera and some other sites. So we work with all our shelters and see what availability we have with our sites as well. So, you know, our goal is not just to move people along and displace them and put them, have them, you know, pop up in another location. Our goal is, if we're going to move people, try to help them as much as possible. There's some that are going to move on their own, and we can't control where they go, but as much as we can help them and get them into something safe, that's our goal.
Okay.
Thank you.
She had another question, and I'll just go ahead and read it if that's all right, Samika. And that question is, has bed occupancy increased now since COVID has decreased, or are they still limited?
Sure, so I can take that. So bed occupancy has increased in 2022. We are seeing an increase. However, that increase, you know, where a shelter maybe had 200 beds prior to the pandemic and then dropped down to say 50 at the height of the pandemic, and maybe it's gone up to 100 now, but there's still that 100 bed loss. And so we know that shelter providers are trying to balance capacity with safety, and how to manage shelter programs without running a risk of them needing to close their doors temporarily because of outbreaks of COVID. That, you know, and so we know our shelter partners are making really hard decisions. We also know that this is this employment situation in our community is very different than we've seen before, and that most organizations are really struggling to recruit and retain staff into this field right now. And so that's impacting the ability of shelters to increase their capacity back to that kind of pre-pandemic level as well.
Okay, thank you. Britt London, you have your hand up, and I've unmuted you if you'd like to ask your question. Britt? Okay. Let me move on to Nancy Rule.
Yeah, sir.
Yes, go ahead, Britt.
All right, I apologize.
No problem. Thank you.
That.
Thank you.
I do have a 4-minute statement that I would like to be heard. Sir?
Yes, go ahead, Britt.
Okay. Yeah, I am a graduate of the University of Arizona. I studied communication and have been observing for quite some time the neurological and behavioral changes in a person when they become homeless. I did experience homelessness for 72 hours myself, and have had subsequent contact with the homeless. I believe that a judgment has been faulted with who the homeless person is and what their step of stairs to become home full again. I would say that. I want to cover the fact that we have a plethora of vacant buildings here in Tucson. The only separation is whether they're zoned to be business or residential, and the consideration of the education and the guidance that is provided to each American who is homeless and their path to their individuality, because a change happens in the brain when you become homeless, and fear and annihilation does take over, which changes the perception of everything. So there needs to be a redefining of the smallest things, how to love oneself, how to interact with one another. Each recipient, I believe, in this new home can bring 4 hours a week as far as the work, as far as construction, sewing curtains, making beds, filling out lists, things that make every single person who is an new occupant, closer to being individual in their thinking. The homeless shelters, I believe, is nothing but a way to define each person to either be a criminal or a victim. There is a lot of criminalization going on. I don't know what you want to call it down in Palo Verde, but that really resembled prison, and induced fear in myself when I went by to see it. But I believe with guidance that adaptation can be made for each person, and these personal topics that you discuss as to whether they need mental health care or dental care, these should be private issues. And if we're going to say that they're private issues, then let us discuss them with the recipient and not with the general public in that manner. I find that many people are afraid to confront and resolve the homelessness issue because the homeless person has learned to become frightful and fearful because of the environment that they're in. To have a group of 100 people in a warehouse all sleeping together is not going to make somebody sleep tight, is not going to be able to calm them down and to bring them to reasonability. They need to be able to close the door. They need to be able to cook their own malta meal or their cream of wheat. They need to be able to piss in their own bathroom and shower in their own bathroom. And I believe that very small what do you call them? They're very, very small apartments, but small kitchens can be built. I know of several contractors who know how to do that, can include all the utilities and accessibility for bathroom and bedroom areas. Please accept my assistance or ideas or work. I can go right out there and communicate and help with this if you need me at any time. I thank you very much for your time listening to me. I'm a
Thank you,
proud
Britt.
American.
Thank you, Britt. You brought up a number of points there. Jason, Liz, do you want to respond or just react to some of the points she made?
I would just say, Britt, thank you. It is, I agree that there's a lot with the trauma of becoming homelessness, how it affects people in different ways, and that being in survival mode is very impactful to people. And so getting them back to stability is really the goal. And everyone is very individualized. So how to, and you're right, it has to be private. It has to be what they need. So definitely appreciate your comments, and that's the work that we need to continue to do. And thankfully there's some best practices out there that our staff have learned and used in their training to ensure that, and not just us, but our community providers, to make sure we're assisting. Neto, if I can, I did notice a couple of questions, and I thought Jason could answer around the entry points for people in the community and who need help or want to get help.
Absolutely. So the first question came from Kirk Alexander and asked if we can list some entry points for people in the community who want to help. If you're interested in volunteering, helping in that type of way, what I would encourage is to take a look at the nonprofit community agencies that are working to end homelessness. And we'll put a link in the chat here to the Tucson Pima Collaboration to End Homelessness website. There's a resources page that lists many of those organizations, and look for organizations that may have similar approaches to the type of volunteer work you would want to do, and reach out to those. We are also, as part of this funding request that I mentioned to the federal government, we have proposed the creation of a trained volunteer street outreach program that would recruit community members to be part of street outreach teams. And so we're very hopeful to be able to launch that project. We're seeing, requests like this from many great folks, Kirk, and appreciate your asking as well. Then the next question asked, what type of prioritization process are you utilizing for housing? I know that the VI SPDAT is often used, but there are a lot of issues with that process. So the VI SPDAT that this came from an anonymous attendee. So the VI SPDAT that's referenced here refers to the Vulnerability Index Service Prioritization and Decision Assistance Tool. That is a tool that is used locally through the coordinated entry process. So if we were to think 15 years ago, the way someone who is experiencing homelessness would access housing would be to go to any agency that provided housing and complete an application, get on a wait list, and probably have some requirements. I need to call every week, every Tuesday by 2 to say that I still need housing, or I need to take some classes before I get put on the list. And what happened through that is that we know that people who had the most significant needs really never moved into permanent housing because they weren't able to keep up with all those requirements, to maintain contact with every organization. And so we moved to a model where there's one application process and one priority list for housing in our community, for the housing that's dedicated for people experiencing homelessness. And then referrals to that housing are made on a priority basis based on vulnerability. And so this tool is the tool that's currently used to assess that vulnerability. In our community and communities across the country, we're recognizing that there are flaws with this tool, particularly that it does result in some disproportionate outcomes for Black, Indigenous, and people of color. And so we locally have redesigned our prioritization process so that we're not using the score results of this tool to influence our housing referrals as much, but rather we're using some of the specific responses that relate to vulnerability. So understanding folks' experience of domestic abuse and violence and risk of violence in their current housing situations, their medical risk associated with being unsheltered, those types of issues. And so that's what we're doing currently. And then we're part of a national demonstration. We were one of 10 communities selected in the country to work on developing new tools and piloting those new tools for other communities to replicate. And so we're part of this national working group right now. There's a team of folks. I think Samika, who is here, I think is part of that team from our community that's working on developing new tools to replace the VI SPDAT.
Thank you, Jim.
And then the last
go ahead.
question. So the last question is, what about sheltering people who have drug disabilities? That is sheltering them in spite of addiction. And what about not breaking up the community of people who have lived together for 10 years in a homeless situation? These were things that were brought up in the 2-day August program. So Liz, I don't know if that's something you'd like to respond to.
Yes, thanks. So, again, sheltering people who are ready, despite any other things that are going on in their life, including an addiction to substances, should not be a barrier to housing people. And so we will continue to support those who want to be sheltered and have those, who do demonstrate or share that they have those issues. So we call that harm reduction. We're trying to give them shelter and connect them to services, and hopefully they do want treatment. And if they don't, we keep engaging them until they indicate they're ready for that. But we do see a tremendous amount of success with people who do have addictions, who do better once they have a roof over their head. And so as far as people trying to keep people who are in essence families, because they've kind of been living together on the unsheltered, unhoused. We definitely want to try to keep those communities together. We saw that happen when we moved people into the Wildcat Inn, and now many of them have found their own housing, and they just need to maintain their community, but they don't have to live unsheltered to do that. So keeping those support networks, I think, is really important. And that's what we strive to do with those people that we're in contact with and trying to support. So thanks for bringing that up, Sharon. And those are some takeaways that you got from that day. So it's great to see that.
Thank you, Liz. Nancy Rule has her hand up, and I believe you're unmuted. Nancy, welcome.
Thank you. At some point, I think maybe in the last session, there were 2 cities that have been successful in lowering homelessness. Was one in Utah and one in Ohio? Does that ring a bell to any of you?
I think you're referencing the cities that were mentioned that have achieved functional zero.
Yes.
Which is, yes, and kind of inside, kind of insider baseball talk about community response to homelessness. This idea of functional zero is when there are fewer people coming into your system on a monthly basis needing services than the number of people who are being referred out to services that for whom there are services available. So it means your net reduction month to month is in the right trajectory. It's kind of a simplified explanation there, but yes. So there were a few cities mentioned during the session.
Was anybody from Tucson in contact with them to see if there was any suggestions that would help Tucson?
Yeah, so our folks from the city of Tucson, as well as Pima County and representatives from the Continuum of Care, participate in Built for Zero, which is a national group of communities that are working toward those functional zero goals. And so there's a team of folks locally who are meeting with those other communities and who have been learning from some of the communities who have been able to achieve functional zero. I don't think there's anyone on the panel today who's been participating in those direct sessions, unfortunately, but there is a connection between the city, between our community and other communities doing that same work.
Okay. Thank you.
Thank you, Nancy. Lisa Reams, you have your hand up. like
Yeah.
to ask your question.
Hello. Thank you to Liz, Ernesto, and Jason for doing this forum. We really appreciate it. Lisa Reams from Pima Council on Aging. Just wanted to enter the voice and needs of older adults to the table. I know that's an issue that you all are aware of. Every team, every table at PCOA, as well as every collaboration with community partners over the last probably year and a half, the issue of older adult homelessness and lack of housing stability and lack of affordability has been like the #1 issue on the table. And the calls that we've gotten at PCOA have risen exponentially. I know that's not news to you, but there are issues surrounding that where older adults are being priced out of the housing market, possibly for the first time, experiencing acute first-time homelessness that we're very concerned about. And sometimes the systems, the way that they're set up, aren't that I mean, they're not easy for anybody to navigate, you know, that they're challenging systems at times, but especially for older adults where they don't necessarily have the ability to raise their income beyond what they're getting from Social Security, or it's not easy for them to just pick up and relocate somewhere else. They experience health issues, disability issues, cognition issues, vision and hearing issues, mobility and transportation issues, that even trying to get into the the system to be assessed for what services might be available, or somebody that can help meet their needs with affordable housing or homelessness. It just even getting in the door can be challenging for them. So it's just really a huge issue for the older adults we see every day, and the desperation of people with really very few options is really weighing heavily on our staff at PCOA, and I know on a number of our community partners as well. So just wanted to enter that to the table. I know you're aware of it, but want to make sure that whatever we're going forward with as a community really takes the special needs of older adults into consideration. Thank you for your time.
Thank you, Lisa. Thank you for your work and all the team at PCOA. It can't be, we cannot stop talking about it, Lisa. So don't ever hold back. We need to keep that at the forefront of the conversations on the impact to, and we, you know, are unhoused, the same as those who are older adults, are elderly. You know, these are vulnerable populations that really need to be kept, kept at the front of the understanding of who have these great needs. And so I completely agree with you that this is a concern, a big concern for our community. And I appreciate that there's some work being done through the Elder Alliance and some other agencies to get some strategies out to address what you're talking about.
Thank you, Lisa. Liz, there's a question in the chat from Anonymous. Thinking about the work of the Housing First office, how many emergency beds do we have now? Are there plans to scale up? How many people are expected to exit homelessness in a year, roughly? How does the current rate of exit compare to the total numbers we are seeing? And thank you for our work.
I'll just talk with Brandy not here. You know, there's beds that the city is operating, and then there's beds across the whole system, which Jason spoke about earlier. I think don't have those numbers handy to share with you, but I think I mentioned we're trying to scale up on the rooms that we have. Again, non-congregate means they have their own room. That has proven to be really good, but at the same time, we're not fully utilizing the space. So looking at increasing, doubling up in those hotel rooms. As far as exits and comparing them, that I think that's a good thing for us to track and share with the community as far as the work that we're doing. I'll work with my team to hopefully maybe create a dashboard to kind of track the work that we're doing. Because if we say today we're housing 152 people, that does not capture everyone we've housed with those sites up to this point. So it's only a kind of a snapshot in time. It would be good to track the work of who we're housing over time and how many people are exiting into permanent housing, just so that way the community can see the impact of this work. So we'll work on hopefully creating that kind of site where people can go see what are we doing. And I think that'll be a great way. As far as the one before that, I think we skipped just to say, you know, as far as advocating for increased resources, you know, that's a harder question. Again, I know that the city and the county have committed a lot of resources. The question is, should they commit more? I think they've really, with all the funding we've gotten from the federal government, have been giving quite a bit of those funds towards this work around the unsheltered. So there's been a tremendous commitment there. HUD has been putting out a lot more funding around emergency housing vouchers, as well as there's a new opportunity for us to apply for some new rental assistance vouchers called stability vouchers, which we're going to go after. And again, we have our VASH, which is for veterans, homeless veterans. So making sure we're working with the VA to fully utilize those. So there's resources, but who can you go to? Continue to work with your policy makers, both at the local level and the state level and the federal level, to say we need to continue to commit resources to this issue so that we can have the greatest impact. So I would just say at all levels, just urging for more support.
Thank you, Liz. We had a question about our vulnerable elderly homeless individuals. We have another question about the young population. We had an advocate at the two-day session for teenagers, and I don't think that person's here. The question is, can you talk briefly about what is being done for this population, the young people?
Sure, I can field that. So a couple of years ago, Tucson was really fortunate to be selected as part of a large national demonstration to develop new strategies and approaches to addressing youth homelessness in particular. And so we're talking about folks who are under the age of 24, so including young adults as well as teenagers. And so that funding initiative brought about $4.5 million over 2 years, and now continues on an annual basis at about $2.2 million a year. And that's funding in total about 91 additional units of housing for young people experiencing homelessness, and a number of community programs, as well as education and employment services, peer support services. So we know at that age, like peer services and peer support and outreach is really important for folks as they're kind of going on their trajectory toward improved health, well-being, education, employment, and housing stability. And then as well as housing navigation, and we launched host home programs that are being administered by Our Family Services through that program, through that opportunity as well. So we're continuing to use the lessons that we're learning through those programs to kind of shape how we continue to address youth homelessness. What we see right now, where we're not seeing large rises in the number of young people experiencing homelessness showing up in data. And so primarily through these planning processes, we're really focused on populations who are sleeping outside, knowing that they're at the greatest risk of health and safety, and honestly at the greatest lethality risk, right? Like sleeping outdoors puts folks at the greatest likelihood, I apologize about dogs, of death on the streets. And so through this planning process, we're really focusing on those populations that are sleeping outside the most prominently.
Okay, thank you, Jason. There's a couple more questions from Anonymous, but I think you, Jason, and Liz have somewhat answered those questions about funding and who should the community talk to? What should the community demand to help resolve this our homelessness situation. Don't see any other hands up. Do we have anyone else who'd like to ask a question or put something into the chat?
And Neto, I apologize for the difficulty there. I'm wondering if we could continue on to the prompt questions, as those directly inform the planning process that we need to participate in, and then if there are additional Q&A, covering those at the end, just kind of being conscious of time.
So there's our first prompt question. What do you see that is currently working well in our community's approach to reducing unsheltered homelessness? And that's an open question to our participants. If you'd like to put your
And
hand
I would
up.
just add, yeah, and
ahead.
I would say if you really encourage people to put that in the chat too, because we're going to take all the notes from today's meeting. So knowing that time is limited and not everyone can speak.
Right.
If we would love comments, and we'll take those back.
Okay, thank you. There is a question again regarding the prompt. What do you think is working in this in our community to reduce homelessness? We have a shy group, Liz and Jason.
And I'm wondering too if maybe there's a way to get these questions out to the people who attended today. I'm not as familiar with Zoom.
Yes.
Okay.
We can send a follow-up survey. Absolutely.
Registration
Okay.
list.
Yeah, we'll do that. And let's just go through the questions so people can start preparing for those. Oh, and I do.
We do have a question from Natalie. Natalie, do you want to engage on this question?
Yeah, I just wanted to say that, I think that the housing first model and the really low barrier, like low barrier housing is the only thing that I'm genuinely thrilled to see working. And I think that the office has done a really great job of working with the Wildcat and the new no-tell motel. Folks are still hesitant because of certain things like curfews and things, but I feel like people are beginning to trust that a little bit more. I definitely think it works better when the city is running it than the auxiliary organizations. People seem to like the city ones much better. And I'm really excited about the partnership with Splinter that's coming up and seeing how that works to address these issues and reduce unsheltered homelessness. But anyway, I want, and I hope, and I know that this is the case, that the city is moving toward opening more low barrier shelters. And I really hope we just see a dramatic increase in the number of places like the Wildcat and like the no-tell.
Natalie.
Thank you.
There is something in the Q&A from Lynette. It's more of a statement rather than a question. Some cities are building tiny homes, creating little villages for vets. There are many low-cost, sustainable options for building. If there is a designated spot or encampment, many are affordable. There are many affordable building methods. Her personal favorite is a method developed by Nader Khalili, started foundation in California, CalEarth. He sent blueprints to the city, and he'd like to share the blueprints if there's interest in there. Another comment, what is working? The very low barrier shelters, housing programs that allow their private spaces and independence. Okay. Jason, so we go to the next slide, the next prompt question?
Yeah, I think there are a few additional responses to that in the Q&A. And then there's also Shannon Jenkins has her hand up. So maybe while unmuting Shannon, I'll read the other responses to this that have come in the Q&A field. So we have from Zoe Kukumbu, what is working? There is people add them, I lose track. Very low barrier shelters, housing programs that allow people their private spaces and independence. From Samika Milligan, I think TPCH is adamantly striving toward reducing barriers related to Black, Indigenous, and people of color, and addressing those barriers with sincerity. From an anonymous attendee, I'm part of a local housing justice organization interested in making sure that the new practices in regards to encampments are implemented in a humane and respectful way. Oh, I apologize. This is a question, so we'll come back to it. Who's leading the task force doing that? So we'll come back to that one. And Shannon let us know that she didn't mean to raise her hand, so we don't need to go over there. Samika Milligan added, while also putting their best efforts out there and really listening to the community as a whole to help reduce barriers. I think this is really important to the initiative and community as a whole. And Ray Vermeil added the funding that Interfaith Community Services has received to help people pay the difference between their old rental rate and current rental increases. So there are some additional items that folks have identified as working.
Okay. Thank you.
I did provide a response, just so if there's any feedback related to the task force, please feel free to email me directly with any comments or feedback that you would like for the task force that is working with the city manager has pulled together. And I put my email in the response to that question if anyone wants to email me directly.
Okay, thank you. Natalie, did you still have another comment question? Your hand is up. Okay. Should we go on to the next one? Next slide, Jason?
That sounds wonderful. Thank you.
Mm-hmm. So next question is prompt question for discussion. What do you see as the most important step we should take as a community to reduce unsheltered homelessness? That should prompt a lot of discussion. Natalie, you're back up. Okay.
Yeah, I think the first step is decriminalizing camping, because immediately we just need to provide the lowest level of stability in folks' lives. And in order to allow them to get through and access services and sort of consistently access caseworkers and keep cell phones, it's like that. And a thing that a lot of folks have asked for in encampments is a safe place to store their valuables like cell phones and their IDs, because those things keep getting stolen and are like the barrier that folks experience over and over and over again in terms of trying to access services. So just providing like lockers or a safe place to keep documents, or even like somewhere to store documents. We've been talking about it with Caridad, the food bank, and trying to think of creative strategies. But I think that allowing people to just stay where they are and then have somewhere safe to keep their IDs will allow them to start to navigate the very tricky waters that is, you know, accessing services.
Okay. Jason, there's some questions in the Q&A and other comments.
Yep. So in there we have from Samika Milligan, there needs to be more outreach to homeless camps for resources and not criminalizing them. From Cheryl Richard, we have increasing the number of affordable housing units. From Zoe Kukumbu, an important step is compassionate and consistent outreach. The stepping back to the prior question, an anonymous attendee said that they believe that the city's approach to holding providers accountable to the services they're funded to deliver is working well. And then there is so some additional from an anonymous attendee: city-owned housing, creating mixed income apartments, establishing policies in place that landlords cannot discriminate against income source is a great start, but landlords will probably ask for higher credit scores, which will create the same problem. From Zoe Kukumbu, decreasing the number of police responding to encampments, opening bathrooms. And then there was a question from an anonymous attendee that asks what would like to know what we see as the major barriers to our offices or departments being able to more quickly move people into housing. What do we need more of? Help us understand what you need. So Liz, I don't know if you'd like to take the lead.
I would say very easily is more housing. So, you know, the services, again, is there adequate services? You know, that's still a need, but without, you know, all our service providers are saying if we don't have the housing, it's much harder to get those services to the people. So being able to identify units and expand what resources we have around housing, I think has to continue to be one of our main focuses.
Thank you. There's a question from Chris Basil. Can you clarify staying in camp? Are you stating you want camps to stay in neighborhoods, or behind people's homes indefinitely?
So I'll take a stab at it. So, you know, one of the things we're trying to do is identify those encampments that are existing and what level of and I'm sorry for stumbling over my words, that the assessment I had mentioned at the start of the program was that there's a tool now, and part of that is being close, you know, necessarily close to, you know, right in behind a house or in places where there's, you know, significant criminal activity going. That's not, that we do not want those type of areas to remain. So one of the things we've tried to do, for instance, is those areas where they're not affecting, you know, they're not being, we're not seeing harm, safety issues, concerns to surrounding neighbors, where those are the ones we're talking about allowing them to stay. Again, we don't have any place where we say this is the okay area to camp, but we're also where people have already been established, if they're not creating problems for themselves or for other people. Because part of, and one of the things I want to say that I think is really important is, you know, we often think that people who are unhoused are somehow a threat to others. And actually, they're often the most victimized are the people who are experiencing homelessness. So, you know, they're often the victims as much as anyone else is. So how do we keep everyone safe, whether they're housed or unhoused? We see them all the same, but it's where do we, you know, when we talk about allowing people to stay where they're at, those are really tough decisions. That's why we're using a tool to help us, so we're not being subjective in making those decisions. So it's tough, but we are doing our best to refine that tool and make sure it's working, and we're not moving people as much as we, you know, as little as we can until we can get them into real housing.
Okay, thank you. There are a couple of questions in the Q&A that deal with the amount of money that renters have to come up with, as well as rent control. What powers or does the city have or do have in regulating how much money landlords can charge upfront as a deposit?
So deposits and setting rents are two very different things. So the rents are, the landlord can base it typically by market. And what I mean by that is if people are willing to pay it, then that's market. There's not some kind of standard out there. There is in the state, we have state laws that prohibit local jurisdictions from implementing any type of caps on how much rent can be increased. So we don't have that ability to do it. But what we know is security deposits can never be more than 1.5 times the rent amount, which is in the Arizona Residential Landlord and Tenant Act. So that one is stated and cannot be exceeded. What we do see is landlords can charge different kind of fees that are not part of the refundable deposit. So that's been, again, that's industry practices that cannot be controlled by local jurisdictions. What we did do, which Jason mentioned earlier, is trying to protect people from just blanket discrimination just because they have some type of rental assistance or certain type of income. So that there's a state statute that they believe keeps us from doing that, but our local jurisdiction, our city attorneys have determined that we can create ordinances. So the ordinance we have in place is saying a landlord cannot discriminate just because they have Section 8 or another type of rental assistance. They should be considered like other residents through their screening criteria. So we know that there could be other ways people can be screened out, but at least we want our all Tucson residents to be given the opportunity to be screened and have an opportunity to rent a unit. So I hope that answers the question. I probably answered it more than what you asked for, but those are some examples of what we can do as a local jurisdiction and what we can't.
Okay, thank you, Liz. Let's move on to our next prompt question. I know there's some questions in the Q&A, but let's move on to the next question, continue this discussion. Did I go one too far? What are we?
This is right.
Yep. What are we not doing that we should be to reduce unsheltered homelessness? Any discussion here?
So while folks are maybe adding some answers in there, Neto, one of the responses that came into the last question seems like it kind of gets to this, which is the idea of safe parking. So there are some communities in which there are sort of safe lots where people who are experiencing homelessness and are residing in their vehicles have a safe place to park overnight, have access to maybe restroom and shower facilities, food items and resources, and so that point of entry. And so that was brought up by Smith Milligan as something to consider locally. We've also seen a few, both in the last question and in this question, responses related to incentives, to providing incentives to landlords to increase their willingness of property owners and property managers to rent to folks that are either may have either on vouchers or receiving assistance, and or folks who maybe otherwise don't, who don't meet income eligibility, don't have 2.5 times the monthly rent in household income, maybe providing incentives for more lenient rental policies has been identified. Also, Zoe Kukumbu mentioned noting that not sure if it's possible, but trying to find ways to conduct outreach to folks who may be on the brink of homelessness and find ways to prevent homelessness for them. Nat Wynn brought up decriminalizing the organizations that offer food and supplies for people in public parks. Lynette Price mentioned that she'd like to see an encampment where all are welcome. If there's one centralized place where people can gather, then it would be a way to consolidate resources and services. Nat Wynn also brought up immediately making zoning exceptions for people who are for organizations that are trying to build things like tiny home villages. And there are a lot of people who are actively trying to do that in the community.
Thank you, Jason. Okay. I don't see any hands raised up. Let's go on to another question.
And we got a couple more while you're clicking to the next slide, Neto. Jen Darland with Pima County shared ongoing support after housing, ensuring that people don't return to homelessness. Lynette Price shared seeing some sort of a shuttle service to offer transportation or rides to people in need. And Chris Basil mentioned that the city can rezone areas and that she'd like to see infill and the installation of small homes or freight cars. These are low cost options, and as Britt had suggested earlier, people experiencing homelessness can contribute to the build and or other work areas that would be needed, in particularly areas that are close to transportation. And then hiring additional housing navigators, social workers, and outreach workers was also added.
And those are a lot of recommendations there. Thank you, everyone. Anything else here? Foraging areas. Okay. Jason, Liz?
I'm sorry on that one on foraging. I'm not sure what they mean by that.
Yeah, not either. Yeah. Okay. All right. Any other recommendations? Please put them in the Q&A. Again, always email the department, Liz directly, Jason directly. And Zoe wrote that the other recommendations, outreach workers provide basic needs, supplies to folks living outdoors to take care of themselves. Have neighborhood liaisons that would work with housed and unhoused neighbors in areas with encampments. Thank you. Okay. So we're just about 10 minutes out from 7. And some last thoughts or remaining questions from our group? Chris? Oh, I'm sorry, Chris. Yes.
Oh, hi, thank you.
I apologize.
I think foraging is very successful. There was a vacant lot on the east side that city councilmen wanted to know what to do with this property. And I suggested foraging. You grow fruit trees, you grow food trees, you can even implement farming. And then people can forage for their own food. They pick their own food. And I think it would be very successful in central Tucson to designate a foraging park, a foraging area. It'll complement the small homes or free car community that pretty much everyone suggested that. So, and also teach people how to grow their own food and help them work into an employment opportunity. So foraging it's been a successful model in Portland, and I'm sure there are a few other cities that have done it. So,
thank you, Chris. You taught me something new today, so thank you for that. I was unaware of that model. The other thing I just want to share is one of the things that we didn't mention today is, and many of you may be already aware of this, we have a plan around development of affordable housing, around creating and preserving units. One of the things I do want to say is we're actively working and trying to develop the capacity for other people to do developments like tiny home villages and other types of models that we've discussed today. You know, where the city, we want to be part of the solution. We can't do all the development, and there's already other developers that have been very successful here, but funding for affordable housing is very expensive. And so the resources for that is limited. But we know that there's other groups, nonprofits that are looking at the models for tiny home villages, container homes, other things, modular homes. And so we want to be, this department, Housing Community Development, we want to be a resource and help build that capacity. So that it's not just the city doing a lot of this work, but where we can help with gap financing and other technical support. We're ready to do that. Again, I think there's just a lot of people who are have great, where I always think of the idea that we all have different roles, and that we should all be doing what we do well. And again, how we continue to bring other community models, and how we bring some of those developers who've done those type of models and having them do that in our community. That's a great way for people to help us to reach out to them and say, would you consider doing that in Tucson? So again, many of you are very informed about what other communities are doing. So happy for you to share that with us, or reach out to them and say, we could use that here in Tucson too. So that's some of my thoughts when I hear some of these great ideas and things that are happening in other communities. I know one of my hopes is to continue to find ways to, the city manager has indicated, to talk to the interfaith groups and how we can get parking lots and some of those conversations about how we can get the churches and other faith-based organizations to help us, since they have often, that's very in line with their mission, to help the community. So one of my thoughts is really around how can we continue to hear from you and provide these type of updates. So I'm going to ask Jason if we can continue to do something like this, maybe on a quarterly basis, so that our community can come and hear updates and also continue to provide input to us. I don't think that this is a one-time conversation. I think there's a lot of momentum that we don't want to lose out on, and continue to engage with the public to make sure that we're all kind of walking in the same direction and making progress.
Thank you, Liz. Jason, any last thoughts?
I want to thank everyone who made it out this evening for this, and for those of you who also participated in the 2-day session. Thank you so much. We absolutely can continue to have these conversations on a quarterly basis. Thanks for that recommendation, Liz. So please be, if you are not already subscribed to the Housing and Community Development department's web newsletter, please go to tucsonaz.gov and then /HCD for Housing and Community Development. There's a newsletter sign up right there. You can also go to tpch.net, /news, and there you can sign up for the Tucson People Collaboration and Homelessness newsletter there, so we can keep in touch with you that way. And then, as we mentioned earlier, we will also be sure to send out tomorrow a follow-up survey that'll include those same 4 questions again, and an opportunity to share any other input you may have. So if anything comes up for you that you didn't have an opportunity to share today or didn't think of until you're lying in bed tonight, please absolutely respond to that and let us know. We appreciate your continued partnership and investment in this work.
Thank you, Jason. Thank you, everyone, for joining us this afternoon, and we'll continue this discussion. Thank you, Liz.